You've probably come across plenty of YouTube videos or online articles warning about the early signs of prostate cancer, usually with an urgent message that if you have urinary symptoms, you must get checked for cancer immediately. But the truth is a little more nuanced than that. Let's start with a key point. Most prostate cancers don't actually cause noticeable symptoms in the early stages. That might sound surprising, but it's because of where prostate cancer usually starts. The majority of these cancers begin in the outer peripheral zone of the prostate, which is far away from the part of the prostate that wraps around the urethra, the tube that carries urine. So in most cases, the cancer doesn't press on the urethra or interfere with urination. In rare cases, prostate cancer can grow in the central or transitional zones, closer to the urethra, and might cause some urinary symptoms, but this isn't common. So, assuming that urinary symptoms automatically point to prostate cancer is, quite simply, misleading. In fact, when prostate cancer does cause symptoms, it's often a sign that the disease is quite advanced or has already spread beyond the prostate. For example, bone pain, especially at night, can mean the cancer has spread to the bones. Blood in the urine might indicate the cancer has invaded nearby blood vessels. Swelling in the legs can be due to blocked lymph nodes caused by cancer spreading. In more severe cases, cancer may reach the lungs or liver, which could lead to a dry cough or shortness of breath. So, what does usually cause urinary symptoms in men? The answer is something called benign prostatic hyperplasia, or BPH, which simply means a non-cancerous enlargement of the prostate. This condition is very common in men over 50. Symptoms of BPH include difficulties starting to urinate, a weak or stop and start stream, dribbling at the end of urination, needing to go more often, sometimes urgently. These symptoms might be annoying, but they are not typically signs of cancer. Now, why does the prostate enlarge with age? We're not entirely sure, but one theory is that the prostate becomes more sensitive to testosterone as men age. It starts growing more receptors, which in turn triggers growth, particularly between the ages of 60 and 70. For some men, this growth is significant enough to require surgery to improve urine flow. Here's where things get a bit tricky. A lot of prostate cancers are found incidentally when men visit their doctor for BPH symptoms. During the checkup, a PSA prostate-specific antigen blood test is often ordered. If that test comes back elevated, it may lead to a referral to a urologist, an MRI scan, and sometimes a biopsy. MRI technology has greatly improved how we diagnose prostate cancer, but it's not perfect. Sometimes the scan results are equivocal, meaning unclear. These are typically given a Likert score of 3, not clearly cancerous, but not clearly benign either. This uncertainty often comes from the MRI not showing clear signs of restricted diffusion, which is how the scan identifies solid potentially cancerous tissue. In these situations, prostate cancer risk calculators can be really helpful. They combine the PSA level, the physical exam results, and MRI findings to estimate your overall risk of cancer, and more importantly, your risk of having a clinically significant cancer, which is the kind that needs to be treated. So, what's the bottom line? If you're having urinary symptoms, don't panic and assume you have prostate cancer. These issues are very common as men age and are often caused by benign conditions like BPH. That said, it's still important to see your GP, who may examine your prostate and order a PSA test. If the exam or test is abnormal, then yes, further evaluation for cancer may be needed. But if not, there's usually no cause for alarm. In terms of treatment for BPH, your GP might recommend medications. One common option is tamsulosin, which helps relax the muscles at the base of the bladder and around the prostate, making it easier to urinate. About half of men taking tamsulosin notice improvement. But like any medication, it can have side effects, including dizziness, low blood pressure, nasal congestion, and a retrograde ejaculation, where semen goes into the bladder instead of out. If your prostate is quite large and your PSA is over 1.4, your doctor may also prescribe finasteride. This drug reduces the size of the prostate over time, about a 25% reduction over 6 months, by blocking the conversion of testosterone into a more potent form. But again, it's not without side effects. Some men experience breast enlargement, erectile dysfunction, and in rare cases, mood changes or depression. In summary, urinary symptoms are common with age, but not a reliable sign of prostate cancer. Most prostate cancers are symptom-free early on, and when symptoms do occur, the disease is often advanced. If you're concerned, get checked, but don't jump to conclusions. Let the right tests guide your next steps.